Ambassador Anna Jaufeld, my colleagues from UNFPA and the UN system, ladies and gentlemen. Perhaps let me first start by acknowledging that the very fact that we have the Ambassador of Sweden here is an important thing. It's perhaps one of the few countries in the world that has a feminist foreign policy. It's a country that is really driving the feminist agenda. So what an honor, Anna, to have you here with us, because you represent a bigger cause to which UNFPA is working very, very hard for. Once upon a time, there was a remote village in West Bengal, and there was a woman there by the name of Patralekha. And Patralekha was married at the age of 11. She had 11 children, of which 9 survived. And the memory of Patralekha that I have is a very gaunt, bent forward, feeble, emaciated, and a very, very weak, fragile, vulnerable woman. That was my first encounter with her, because that Patralekha was also my grandmother. So I've seen the ravages of parturition and childbirth and the absence of family planning straight up within my own family. And therefore the cause for which UNFPA is fighting for is crucial. It really underpins everything that we do. It has an economic significance, it has a social significance, it has a political significance, but most importantly, it has a human development significance. We know for a fact that even today, as the world has advanced exponentially in the areas of prevention, in the areas of improvement of reproductive maternal child health outcomes, we still lose 830 women a day because of the egregious absence of services that women need. And we know for a fact that what are the 3 things that really kill women in our part of the world, here in Africa? I call it the 3 H's: HIV, postpartum hemorrhage, and hypertension. All preventable. None of it is rocket science. All of it preventable, and yet we struggle with it. Therefore, colleagues, I have to say that we are extremely lucky that we have in UNFPA a leader like Natalia Khan, whose passion, whose understanding, whose forbearance, whose tenacity, and his ability to really rouse the world up in terms of what UNFPA is doing, despite the disparate challenges as an organization UNFPA is facing. I think she deserves a very special applause. So, the Maternal Health Trust Fund is crucial. Started in 2008. I think the importance of this trust fund should never be underrated. Regardless of perceptions, regardless of the gag rule, regardless of which country thinks which ways, it is a few that finally end up making a difference. It's not the many that can actually come and make a difference. So again, I really congratulate the Nordic countries. I applaud the Nordic countries, countries like the Netherlands, etc., who came together with the She Decides initiative. And I think we need more of that. We need more of affirmative action to counter anything that undermines the mandate, the very special mandate that the United Nations Population Fund has. And colleagues, keep in mind, we may be a small organization, but you know, it's not the size of the dog that matters in the fight, it's the size of the fight that matters in the dog. You know? So we have to be relentless, absolutely relentless, regardless of all the challenges we face politically or socially in order to take this crucial agenda forward. We know for a fact that there are 2 basic cost-effective interventions: childbirth attendance and access to family planning commodities. We are in a perilous situation because of the gag rule. Increasing number of unsafe abortions have begun to take place. Absence of the basic services that were taken for granted have suddenly seen a cut in funding. But the most important thing that we can do today is to make sure that we have the power of information that we can give to the girl child. And when Babatunde Osotani talked about that 10-year-old girl child, let's keep that perspective, let's keep that horizon, let's keep the focus there. Because as she comes from the moment she's born, we have to accompany her in that journey so that she's able to fulfill her full human potential, and that becomes crucial. And therefore the underpinnings of countries such as Sweden and Canada and many others who've come together to say, yes, a feminist foreign policy is important. I think for us, we just as an organization have to redouble our efforts in order to do that. In Kenya, UNFPA has been known to be an organization which has been a game changer on multiple fronts. UNFPA managed to get together governors from 15 counties in Kenya, 15 counties that contribute to 98% of the maternal deaths. It was able to unlock financing from a trust fund in New York of about $15 million, brought UNICEF, brought WHO, brought the Kenya Red Cross, brought civil society partners, and went to respond to amongst the highest maternal mortality rates. These 6 counties contributed to 50% of the maternal deaths in this country. The 15 counties that I mentioned contributed to 98% of the maternal deaths. The recent results are showing that the maternal deaths have come down by 1/3. No easy task. What UNFPA did was it went to the last mile. What it did was it galvanized other partners. What it did was actually showed the early steps of UN reforms by partnering up with other entities in order to make sure that we delivered as well. And therefore, the entire issue of delivering as one is become crucial, because what UNFPA did then got accepted also in many ways by the country, embraced universal health coverage. And ladies and gentlemen, you will all agree that the primacy of sexual reproductive health and rights underpins universal health coverage. If we don't have that, we will never achieve universal health coverage. We know that as a fact. And we know for a fact that all the countries in the world whose economies spurred and moved ahead and did well, the first thing that they achieved was reproductive maternal and child health. Take the context of Kenya and Sweden. Both countries had the same population in 1956, 7 million. Today, Sweden's population is about 10.5 million. Kenya's population is 46 million. By 2030, Kenya's population will be 65 million. By 2050, Kenya's population will be around 90 million. By 2050, Africa's population will be 2.3 billion. We all know for a fact that the total fertility rate of Africa is between 4 and 6. We'll actually be seeing a doubling of this population. Why is there this difference? This difference is very simple. The difference is that because Sweden, post-Second World War, which came out of absolute poverty, decided that they needed to focus on human development. They needed to focus on getting the health and education of its population right. 2 fundamentals to the achievement of a demographic dividend. So therefore, a woman was able to plan her family and join the workforce, and therefore the microeconomic picture at the household level improved. There was disposable income. A new generation of kids grew up, Anna is one of them, and therefore she became an ambassador at an early stage of life. And, you know, it may seem funny, but that's the reality, and that's where many of us in Africa, many of us in my own country like India get left behind. Simply because that vision, that perspective is not there, and that political will is not there. What Kenya is showing, it suddenly brought together what I would term as the 3 wills. The first P being the political will. This is one country which declared universal health coverage as non-negotiable. And we just have to do everything to make it happen. Again, the mandate of UNFPA becomes crucial in the overall scheme of things. Because without the primacy of sexual reproductive health and rights, we will not achieve universal health coverage. And therefore, the First Lady of Kenya's Beyond Zero campaign has been so crucial to move that agenda forward. And that is why the entire UN Development Assistance Framework, the new generation of the UNDAF for Kenya, which we just launched 2018 to 2022, is precisely
about ensuring that the primacy of sexual reproductive health and rights is protected in the sphere of universal health coverage. Otherwise, it's unachievable. For the first time in Kenya, negotiations took place actually with the private sector. This was not the New York or the Davos. This was not about a global compact and saying we do this and that, where the private sector was typically seen as a donor. No. In fact, the UNFPA here in 2012, 2013 was the initiator of the first partnership platform which brought together different companies to look at how we could improve maternal health outcomes. And this matured when in 2015, at the UN the General Assembly, in front of the President of this country, 6 companies, GlaxoSmithKline, Philips, Safaricom, Huawei, Kenya Healthcare Federation, and Merck came together and said, we commit to working with you in these 6 remote counties, which are also very fragile, very unstable, distant, hard to reach counties. And the outcomes have been quite dramatic. As a result of that, the partnership platform is now broadened. Last year, during the UN General Assembly, the Foreign Minister of Kenya launched the platform formally to accelerate SDG 3. And we want to see how the other big 4 items on the agenda of Kenya's development over the next 5 years, which is about universal health coverage, food security and nutrition, affordable housing, and manufacturing, underpins this. And why is all this so crucial? We all know for a fact that Africa, like Kenya, and like parts of Asia, are at the cusp of a demographic dividend. And that ownership of the demographic dividend is going to be crucial. And that is what is going to drive the entire UN reform agenda towards unlocking the real potential. Let me give you some statistical facts. By 2030, agro-business in Africa is going to be $1 trillion. And we know for a fact it is agriculture alone that has pulled the maximum number of people out of poverty in Africa. The healthcare business is going to be $280 to $300 billion worth by 2030. The consumer market of Africa is going to be anywhere between $2.5 trillion to $3 trillion by 2030. Why am I giving you these statistics? They're very important. Because if we don't have a workforce, if we don't have a youth which is employed, which is skilled, which is educated, which is empowered, and which is employed, they will not have the disposable income to buy those goods and services. So it's an interest to make sure it's a win-win for all sides. For the West, to unlock a Marshall Plan of sorts in order to actually make that demographic dividend happen. This is exactly what happened post-Second World War when the United States invested in a Marshall Plan in Europe. What did it do? It created one of the largest markets for the United States of America, and not just that, created a whole group of allies for them. Today, every day, 35,000 African youth are looking for work. Every 24 hours are joining the workforce. Every year, 10 to 12 million are joining the workforce. Every year, barely about 2 million jobs are created. In Kenya alone, every year, in the age group of 15 to 26, 1 million Kenyans join the workforce. Barely about 100, 200,000 jobs are being created. So what will happen? When you're looking at the whole issue of forced migration, when people are escaping the ravages of poverty, and the ravages of instability, and the ravages of inequality, and the ravages of violence, there are very few choices left. The UNDP report on the journey to violent extremism in Africa has clearly shown that it is just these very reasons why young people are getting drawn into violent extremist groups, because it's a livelihood issue. It's an issue of indignity. Again, the collective vote of the UN, driven by the UN Population Fund, whose focuses on making sure that the youth achieve their full human potential, becomes even more critical in this time. So there was this thing of Nike celebrating its 30 years just now. I don't know if you saw that ad, and it's by Colin Kaepernick, and it says that, if you really believe in something, even do something about it, even if it means losing everything
And I think that's the passion with which UNFPA needs to really drive this whole agenda forward. And truly, I think the entire UN reform stems, if you want to see the success, at least of the unfinished business of the MDGs, which is the first 5 goals. Without SDG 3, without universal health coverage, without the primacy of sexual reproductive health and rights, we will not be able to end poverty. We will not be able to end the scourge of malnutrition. We will not be able to ensure gender equality is achieved. So I think it just becomes so much more crucial in the multiplicity, in the multifariousness and the multidimensional nature of the UN Population Fund's mandate, which needs to really find itself, get into the DNA of the new UN reforms.